Hello, my name is Alia. I am a registered dietitian and certified diabetes educator as part of the cardiac rehab team. Today, I would like to help you with your heart-healthy eating journey. I know that changing what you eat can be hard, so understandably, you'd want some good reasons to make some changes. How about this? Research has clearly shown healthy eating habits are important for healing from events such as heart attacks and surgeries, and for lowering risks of future heart problems. The most up-to-date research recommends following a Mediterranean way of eating to protect your heart and keep it healthy. The Mediterranean way of eating involves eating like those who live around the Mediterranean Sea, in places like Greece, Italy, and Spain. This includes eating heart-healthy foods such as vegetables, fruit, whole grains, legumes, nuts, olive oil, and fish. It focuses on overall eating patterns and is flexible and can be tailored to your individual preferences and cultural traditions. To get the most from the Mediterranean way of eating, follow an active lifestyle and prepare and enjoy meals with family and friends. Let me start by explaining the benefits of eating this way. Eating the Mediterranean way can help you lower your blood pressure and cholesterol levels. It can help control your blood sugar and prevent diabetes. Most importantly, following the Mediterranean way of eating can lower your risk of having another heart attack. What do you think? Are these good reasons to think about making some dietary changes? Have you seen the Mediterranean diet pyramid? It is one way to visualize what foods you should eat and how often. You will have received a workbook called the Lifestyle Change and Self-Management Workbook. The Mediterranean diet pyramid is displayed in this workbook. Let's walk through the recommendations together. First, cook at home more often and flavor foods with tomato, garlic, onion, or leek at least 2 times per week. Second, try to use olive oil every day. Olive oil is high in heart-healthy, unsaturated fats and antioxidants. Can you think of any new ways to add olive oil to your diet? One of my patients suggested using olive oil as a salad dressing or marinade. Third, eat whole foods that come from plants every day to protect your heart. This includes fruits and vegetables. We recommend filling half your plate with vegetables at mealtimes. What was your last meal? Did you include half a plate of vegetables? Fourth, I encourage you to choose whole grains often and choose whole grains over white grains such as whole grain bread, whole grain pasta, brown rice, quinoa, and bulgur. The next recommendation may be one of the hardest ones for some people, trying to eat legumes like black beans, red kidney beans, chickpeas, and lentils several times per week. Do you have a favorite dish with beans, lentils, or chickpeas? A great cookbook with some recipes is called the 30-Minute Mediterranean Diet Cookbook. A lot of my patients enjoy having unsalted nuts several times a week as well. Nuts are high in fiber, rich in healthy unsaturated fats, low in salt, and contain no added sugars. Another recommendation from the pyramid is to eat more fish and seafood 3 times per week. Fish and seafood are high in heart-healthy omega-3 fats. Try your best to include fatty fish such as tuna, salmon, or sardines, and seafood such as clams, scallops, or oysters. There are some fish recipes on the cardiaccollege.ca website. The next suggestion is to include low-fat dairy products such as milk, yogurt, and cheese, and limit high-fat dairy products. One fun fact, next time you choose a cheese, look at the front of the package and see how much percent MF, milk fat, is in the cheese you pick. Try your best to choose skinless chicken and turkey more often than red meat. Did you know that red meat includes beef and pork? These meats are high in saturated fats, which are harmful for your heart health. Try to limit your red meat consumption to just 1 or 2 times per week. To reduce the intake of saturated fat, try to avoid processed meats such as bacon, sausage, and pepperoni. Lastly, cut back on sweets because they are high in saturated fats. The next time you are craving something sweet, I would encourage you to have some fruit or nuts instead. By following the Mediterranean way of eating, you can support your heart health and improve your overall well-being. In conclusion, please reflect on your usual ways of eating. I'd like to leave you with 3 questions. First, can you spot just one area in which you could move closer to eating in a Mediterranean way? Second, how could you make just one manageable step to move in that direction to personalize this diet to fit your preferences and cultural traditions? Third, when might you do that? Remember, several small changes to your diet can make a difference to your heart health. You can learn more about heart-healthy eating by visiting the Cardiac College website and visiting the Eat Healthy section. I am also available for a one-on-one counseling session. Just ask your nurse for a referral. Have a great day!